Welcome to our stroke DVD. Now, the purpose of this programme is to help you and your family understand what happened to you when you had your stroke and how it might affect you. The programme follows a fictional character called Stan from the beginning of his stroke symptoms through his rehabilitation to his discharge home. We're only able to show you a sort of snapshot of Stan's care and rehabilitation, and the main parts are played by actors, but you'll be able to see real healthcare professionals in the background and real patients receiving therapy. Remember that every stroke is different and that every patient and their families are affected differently. Recovery can be slow and frustrating, and not everybody makes the same level of recovery, so not everything in this programme will be relevant to you. The information should be used alongside the information in the blue stroke information booklet. So sit back and relax, make yourself comfortable, and I'll see you again at the end of the programme.
When a stroke strikes, it spreads like a fire in the brain. The longer it goes undetected, the more damage is done. To spot the signs of a stroke, you have to think and act fast. F. Face. Has their face fallen on one side? Can they smile? A. Arms. Can they raise both arms and keep them there? S. Speech. Is their speech slurred? T. Time. Just like a fire, it's time to call 999 if you see any single one of these signs. The faster you act, the more of the person you save. When stroke strikes, act fast.
So, how are you meant to remember all of that?
Well, it's like the Macarena dance, you know. Dee, dee, dee,
Sit down, Kurt, will you? Let me eye out.
There you go. Cake's yours, and the scone's mine.
Do you not want the cake?
No, you always get it. You're all right.
I can't feel my left side.
Can you move your arm?
I can't.
Can you smile? Can you smile? It's like on that fast campaign last night on the telly. I think you're having a stroke. I'll ring an ambulance.
Are you ready, Bob?
Oh, yeah.
Right.
Brakes up.
Ready? Ready. We'll just get away when we're ready.
Hello, Mr. and Mrs. Holden. I can give you an update on your care. We've now completed all of the initial tests, which included a head scan.
You mentioned a head scan, Doctor. What did it show?
Your husband's had an ischemic stroke.
A what?
A stroke occurs when there is an interruption in the blood supply to the brain. When a stroke occurs, some brains are temporarily starved of oxygen, causing them to swell and stop working properly. This is why the effects of stroke are worse at the beginning. After a few days, when the swelling starts to go down, some cells recover, but others may not. Even then, other parts of the brain can be encouraged to take over. Ischemic stroke. This happens when a clot blocks an artery that carries blood to the brain. It may be caused by a blood clot which has formed in the main artery to the brain, a blockage caused by a blood clot, air bubble or fatty lump forms in a blood vessel somewhere in the body and is carried in the bloodstream to the brain. A blockage in the tiny blood vessels in the brain. Hemorrhagic stroke. This happens when there is a rupture of a blood vessel in the brain. It may be caused by a blood vessel which bursts inside the brain, a blood vessel which bursts on the surface of the brain and bleeds into the area between the brain and the skull. It is important to understand that no two people are affected by stroke in the same way. Some people have only mild effects which improve in a short time. Others may suffer more serious and long-term effects. The effect of a stroke on a person depends on which part of the brain has been affected and how much damage has been caused. The brain has two sides, hemispheres. The messages, nerve signals, cross over at the base of the brain. We assessed you for the suitability of the clot-busting drug thrombolysis, but you didn't meet the criteria for this treatment. However, being on a stroke unit, staffed by a specialist multidisciplinary team, has been shown to significantly improve recovery. Over the next few days, your husband will meet with the relevant members of the multidisciplinary team, who will complete their assessments, identify what problems he has, and how best to address them.
What is a multidisciplinary team?
It's a team of healthcare professionals with specialist knowledge in stroke care, such as the nursing staff, physiotherapist, social worker, occupational therapist, dietitian, and speech and language therapist, who will work together to coordinate and safely plan your ongoing care needs, both in hospital and when he returns home. You did very well to spot the signs of stroke so quickly and get your husband here as soon as possible.
Hi, Mr. Holden. My name's Terry. I'm one of the stroke nurses on the stroke unit. What I need to do is just assess your swallowing with a simple swallow assessment, because sometimes when you've had a stroke, it can affect your swallow, okay? It's a very simple test. It just involves taking a couple of sips off a teaspoon and then a bit larger drink, okay? All right. Is it okay if I call you Stanley?
You can, but my name's Arthur.
Okay. All right. First teaspoon. Okay. Okay. I just need to hear your voice now, so can you just say "ah" for me?
Ah.
Perfect.
That's nice.
Good. You must be so thirsty.
I am actually.
Okay, again, one more drink, exactly the same as before. Oh.
Ta-da!
Fabulous. One last time off the teaspoon. And then R.
Could we not just have used gin?
Gin probably would have been a lot nicer, but unfortunately, no.
No, that's fine.
That's fabulous. Okay, Stanley. A little bit more refreshing. I need you to drink all this 40 ml of water, okay? Can you manage or do you want a hand?
Yeah, I'm fine. This sounds fine.
Fabulous.
It's nice, that was at Beaujolais.
Okay, that's perfect. I can't see any problems with your swallowing.
Okay.
So we'll get you on to normal diet and fluids.
All right, thank you, Peg.
No problem.
Right, I just want to introduce this information booklet to you, which has lots of useful information, which you can go through at your leisure because it's yours to keep.
Hurrah!
Now, we won't go through section 1 because the doctor's already explained the possible effects of the stroke. Section 2 explains the assessments and tests that you may have. Now, you've already had this and this, and a carotid ultrasound and echocardiogram have been requested for you.
That's easy for you to say.
There are many other sections in the book that will be relevant throughout your recovery, but for today, one more section that you might find useful, Alma, is the section for carers. So if you have a moment, just have a flick through it.
Thank you.
And don't hesitate if you have any more questions.
What's for lunch?
The nurses have been telling me you're trying to get up on your own and that you're lifting your weak arm all the way up using your stronger arm.
Oh yeah, look.
That's great, but you need to be careful. Although your balance is improving, you still need help to stand and step around safely. Your arm needs gentle handling as the muscles are not supporting the joint properly and the tissues around the shoulder joint can become damaged and painful. It's great you want to try things, and we can show you some exercises that can help towards your balance and your arm, and also how to handle your arm safely.
Will I be able to walk again?
It's hard to say with stroke because everyone is different, but there are some stages we do look out for along the way. Firstly, we'll look if you can sit on your own, and if not, we'll work towards that. We also encourage to start to push the weight through the legs and progress to standing. Once you can stand reasonably well, usually with support we can start to look at walking.
Okay, excellent. So we're going to make a cup of tea, okay? We're just going to practice using that left arm in the activity. So if you have a stand up for me, just using both arms to push up from, just nice and slowly.
Yeah.
Good, okay. And so when you're getting things like the tea bag and the spoon, try and use your left hand, okay?
Right.
You can use your right arm to support that left hand.
Okay.
Okay?
Yeah.
Good. Excellent. Use your right hand for the kettle just for safety.
Right. Good, eh?
I know, you're doing well.
I've made a cup of tea before, you know.
Have you? Excellent.
Left hand for the spoon.
Yeah, use that left
Okay.
hand. Sit nice and slowly.
Yeah.
Good.
Uh-huh.
Okay. You can put the tea bag on now.
Left hand.
Left hand. Good. Excellent. I want you to sidestep across
Okay.
and then have a reach down to get into the fridge.
Yeah.
Good. Good.
All right.
That's it, nice and slow, and put it straight on the bench.
Yeah.
Good.
Excellent.
And then just sidestep back across.
Right. I'm cheating. I'm using the wrong hand.
Good. Done. Then unscrew with left hand.
Flipping heck. I'm right-handed, you know.
Good. And pour with your right if it's a little bit heavy.
Okay.
Okay.
Good.
But you can stay with the left.
You're a hard time. I'm looking for the brandy.
You've done really well. I think you're ready for a home visit.
Home visit.
Yes, we usually arrange a visit if a person has problems getting around, managing their daily tasks or needs help with their personal care. Before the visit, we need to arrange for a family member or friend to meet us at the house or bring a key into the ward for access. You will need to wear outdoor clothes and shoes. During the visit, we'll discuss our recommendations with you and with your consent, order any equipment that you may require to make your return home safer. We may advise the support of carers if required. Carers can help around the home with such things as dressing, bathing, domestic tasks, meal preparation and medication.
Can I stay at home?
You will initially need to come back to the ward, but it's the first steps to returning home.
And what about therapy when I get home?
That'll continue too. We have a community stroke team who'll come out to your house and continue your rehabilitation.
Hello, Stan.
Yeah.
And you must be Alma.
Yes.
Well, my name's Phil, and I'm your social worker. Basically, I'm going to be carrying out your assessment today. This will form the basis for any support care you're going to need in the future. Now, I take it you've been told about your home visit?
Yeah.
Excellent. That's going to mean that the kettle's on and there's plenty of chocolate biscuits, Alma.
Too right.
Fantastic. Now, once you're discharged, you're going to receive what we call your joint care plan, which will be in the blue book, or the stroke information booklet as we call it.
Right.
Once you are discharged, obviously we will tell you what services you're going to require and we'll provide them for you. And we will continue to monitor your progress so you can't get rid of us that easy. Do you have any questions for me?
I don't think so.
Excellent. It'll all become apparent and will be in your stroke information booklet anyway. Right, let's see what fettle you're in, Stan. It's time for your assessment.
Stan, you've done so well in the 4 weeks you've been with us. I'll see you again in clinic in about 6 weeks' time, and no doubt you'll have made further progress by then. But Stan, you'll need to remember what I told you about your tablets. If you use the patient reminder sheets that I've put in there for you, that'll help you with your medication. You'll need to request a repeat set of tablets from your GP. But hopefully we'll just see you in clinic next time, but don't hurry back, okay? There you are, take care.
I'm glad there's not too many tablets. Come on, let's get out of here quick.
Yeah, Pat. See, Stan? Nice and healthy. And it's tasty. Better than clogging up your arteries with all that fatty stuff.
Oh, it's not bad.
And brownie points for me when we meet the dietitian.
Not bad at all. You're a wizard of the microwave.
So your cheeks come back.
Hi, Stan.
Yeah.
How are you doing today? Are you happy for us to go through some therapy?
Yeah, I've been doing the exercises that they told me to do, but to be honest, I've been struggling with a few of them. So what we're going to do today?
Well, today we're going to concentrate on standing practice today, but before that, if you can show me the exercises that you're struggling with. There's no rest for the wicked.
I'm pleased to hear that your mood's lifted and that you're no longer feeling depressed, but I understand that you're still feeling extremely fatigued. I mean, it's not uncommon for patients to feel extremely tired even after the least bit of exertion and even this long after they've had their stroke. But what I'll do is I'll mention it to your GP and I'll get him to further monitor you alongside your mood.
I mean, the tiredness has improved slightly since I've been doing what the stroke team told me to do at home. But will it go away?
Well, there is scope for improvement, but everyone's different and it can be an ongoing problem.
Will I be all right for my fortnight in Spain?
Spain?
You're not coming.
If you continue to progress, I'm sure you'll be fine to go on holiday.
Right.
It's nice to see that Stan made such a good recovery, but you've got to remember that that's not always the case for everyone. But there are a range of voluntary organisations that can help, such as the Stroke Association and Connect and Different Strokes, Age Concern and local stroke groups, to name but a few. You'll find their contact details on section 10 of the blue stroke information booklet.